thrombolytics agents. It contains the streptokinase, alteplase, reteplase, aminase, anistripase, tinactiplase, urokinase. These are the thrombolytic agents, and the mechanism of thrombolytic agents by intrinsic and extrinsic pathway. The extrinsic pathway and intrinsic pathway both led to the formation of blood clot. The extrinsic pathway is activated when the rupture is outside the vascular system, and intrinsic pathway is activated when a trauma is inside the vascular system. The intrinsic pathway activated the factor 3, 7, 4 and calcium ion, and then it activated the factor 10A, 5A calcium ion fibrinogen prothrombinase, and hence it activated the 2-factor calcium. Then it activated the thrombin 2 fibrinogen formation that is insoluble, and then it activated the fibrin monomer that is soluble, and then fibrin polymer that is insoluble, and it then led to the formation of blood clot. The intrinsic pathway activated the collagen, high molecular weight, kininogen, adenosine diphosphate, and then activated the factor 12, then 12A, 11 and fibrinogen, and then 9A to 8 calcium, and then 10A prothrombinase, and the process is same as in intrinsic pathway, and it led to the formation of blood clot formation. Here we will discuss about the mechanism of streptase, streptokinase and aminase that is also led to the formation of clot by the conversion of plasminogen to plasmin and then splitting it to the blood clot formation. Here is the drug's parenteral doses and half-life. Streptase streptokinase is parenteral doses is 1.5 million and half-life is 18 minutes. And aminase and anistripase, its parenteral doses are 30 units and half-life is 90 to 105 minutes. Okay, there is a treatment for anemia. It is treated by folic acid, vitamin B12, ferrous sulfate, ferrous gluconate, and Integra. The mechanism of action contains the iron combines with the porphyrin and globin chains and to form a hemoglobin, which is critical for oxygen delivery from the lungs to other tissues. Iron deficiency causes a microcytic anemia due to the formation of small erythrocytes with insufficient hemoglobin. Here is the description, results, and measurement unit of this. Here are the doses and parenteral doses and half-life of the drugs that are used for treatment of anemia. First of all, the folic acid, its enteral doses are 200 microgram and 400 microgram, and parenteral doses are 300 milligram per 5 milliliter, and its half-life is about 2 hours. Ferrous sulfate, its enteral doses are 160 and 325 milligram, and its half-life is about 6 hours. Ferrous gluconate, its enteral doses are 200 and 500 milligram, and half-life is about 6 hours. The ferrous fumarate, its half-life is about 6 hours. Okay, now we will talk about the mechanism of action of folate cycle. It starts from homocysteine, and from homocysteine it will convert the methionine transfer reductase enzyme to methionine, and by taking the adenosine triphosphate it converts into the adenosyl methionine, and from this it will convert to adenyl homocysteine by the conversion of DNA and RNA synthesis. It is very important because if it not formed, then new cells are not formed. From adenyl homocysteines, it take some water and then it convert to the homocysteine, and homocysteine then led to the formation of homocystinemia. It is a very serious condition in medical condition that is characterized by an abnormally high level of homocysteine in the blood. And the vitamin B12 and B6 that is came from the methylene tetrahydrofolate enzyme. This is very important in this mechanism of folate cycle. Here are the antral and parenteral doses and half-life of these drugs. Here you can see the full table of these drugs. Here is the antral and parenteral doses of these drugs. You can see in this table. Here is the end of this lecture. Thank you very much.